Hey guys, thanks for joining us on another dry needling video. So today we got Jasmine here. We're going to be needling her glute area. So more specifically, we're going to be aiming for her glute med and glute min muscles, which sit to the outside portion of her pelvis and attach to the trochanter on the outside of her leg. These muscles help with kind of hip movement to the side and stability around the hip. I like to call them these rotator cuff muscles of the hip, if you've ever heard that term before. So we have Jasmine lying down over here. What we're going to do, we're actually going to drape over so that we can cover up her a little bit. And bring that down just a tad. We're going to clean that off over here. Now, because the glute muscles are a bigger set of muscles, generally we need a longer needle than a thicker one, because if you use a too thin of a needle, it does tend to bend easily. So in this case here, I'm going to be using a 75 millimeter, or about 7.5 centimeters, not about exactly. So what I'd like to do, come off the trochanter, the big bone on the side of the hip, and come a few inches off the top. Now these muscles are quite deep, to sit right on top of the pelvis, so here we're going to poke, needles in, and we're just going to go first pass all the way down. So again, that's about a 7.5 centimeter needle. We have about, let's say about 1.5 centimeters remaining here, so that should be about 6 centimeters into her leg. Good math, Cam. So what we're going to do is just going to, once we do the first pass, so we actually do touch her pelvis bone with the needle on the first pass to make sure we get through all the tissue that we want to be getting through and nothing that we shouldn't be. Good. And again, no blood. So again, same thing, we're going to do a few areas around the hip here. How'd that feel, first one feel?
It's okay.
A little bit sore?
A little bit, yeah.
So there are a lot of muscles in this area. We've got the piriformis that comes slightly underneath where I'm at right now. Now the one structure that we have to watch out for, especially when we come around the hip area, coming closer to the middle, is the large nerve in the body called the sciatic nerve. But we're off to the side quite a bit, so we probably won't be hitting that. So that's about 5 centimeters into the hip there. And if I were actually to let go of her tissue, it does go a little bit more. So first pass, I'm on her pelvis bone, and I'm just going to piston around the area to get a nice little twitch there. Just like that. And again, no blood.
Good job.
No blood.
Hashtag no blood.
Hashtag no blood. So, again, fine area of the tightness. Needle goes in, first pass. All the way down to the pelvis, about 5 centimeters, 5.5. And piston, nice twitch there. So you might not be able to see the twitches as prominently as like a surface muscle because we are going pretty deep here. But I can definitely feel it. And I can tell you that Jasmine definitely feels it too.
She definitely feels it.
She definitely feels it. A little bit of blood!
Oh my god!
That's okay. We'll just wipe it off. Hashtag fail.
Hashtag blood.
So, usually when there is a bit of blood, it means we've nicked a little bit of the blood vessel. Not anything major. There are capillaries and small veins all over the area. A little bit of pressure helps to stop that. I won't put that in your face. Alright, let's do one or two more here. Same thing. It's coming off the side of the hip here. Feeling for trigger points or tight muscle bands. If you're interested in what a trigger point is, watch my other video. I explain what that is. Again, needles in. That's a little bit more surface. And first pass, nice little twitch there. Can you feel it?
Oh yeah.
Nice, another one there. Oop. There you go. No blood!
Yeah!
No blood.
Cool. So that's for the glute med and the glute min. Okay, so we're gonna also aim for the piriformis muscle now. The piriformis muscle comes off the sacrum, So sacrum is just this triangular bone at the end of your spine, and what we're looking for is the proximal portion of that, so right off the outside edge. Now, especially with this needling technique, we need to be careful of the sciatic nerve that comes right down the middle of the hip. So, come off, kind of angle it away from that nerve. Now this muscle is again pretty deep, so you probably won't see too many twitches, but I can assure you Jasmine feels them.
Oh yeah.
There you go. So this is a 5 centimeter needle. So that's about halfway through. Nice. Let's go one more in there. Pinched? That's about 2.5 centimeters in there. For you Americans watching, that's about 1 inch.
Yes.
Okay, perfect. Alright guys, thanks for watching. So today we just needled Jasmine's hips. More specifically, it was her glute med, glute min, and we also get a little bit of her piriformis. How does it feel, Jasmine?
Good, a little bit sore. Yeah.
A little bit sore. So generally, as I mention all the time, is that the soreness is about 1 or 2 days after the needling session. Maybe a little bit more if it's the first time. You can put some heat on it to get the circulation going, but for the most part, you should be fully functional afterwards. So Jasmine, can you just show me a squat? Tell me how that feels.
Good.
Awesome.
Yep.
Sweet. Alright guys, well thanks for watching. Hit that subscribe, smash that notification bell, and like this video, so stay tuned for future videos. We're going to be trying to post something every week.